Restore your sex life. Increase your self-confidence. Laguna Medical Care, located close by on Laguna Hills, invites you to come in for our grand opening $99 special. Your visit includes FDA-approved medication, physical exam, private consultation, ultrasound, testosterone test, PSA test, free adjustments, and 1-year prescription. If you don't respond to our medication on your first visit, it's free. You have everything to gain and nothing to lose.
Welcome back, folks, and as promised, we have two doctors from Laguna Medical Care, and I'd like to introduce them. One of them is a friend of ours, not that you're not going to become a friend, but Rizwana Mohseni has been on several times, as I've mentioned before, on our Senior Focus show, so it's good to have you here. And Dr. David Porzio, I think it's your first time here, right?
Yes, it is.
Well, it's great to have you here. And you're with the Laguna Medical Care. And as I've been saying, you know, we're going to talk about a subject that may make people a little uncomfortable, but it's an important subject. And first, why don't we get you folks introduced? And I'm going to start with David here, because I think people know you a little bit here. You're familiar, so we'll start with you.
Well, my name is David Porzio. I'm a cardiologist, as well as an internal medicine doctor. I'm local in that I went to school, Cal State Long Beach, and medical school at UC Irvine. Did my residency training on the East Coast in Massachusetts, and then returned here in the early part of the 2000s and have been here ever since.
Very good. So you went to a UCI, huh?
Yes, indeed.
All right, good school. And Rizwana, again, we know you, but tell us a little bit about yourself.
Good morning. I'm very glad to be here today. As you know, I have a practice in Laguna Hills. I've been practicing in this area for about 12 years now. I did my residency local here as well. Our office is on Cabot, so very close to Laguna Woods and Leisure World. And so we're here to talk about something new that we have in our office. And like you said, a difficult topic, but one that is very important. So thank you for having us here today.
Well, it's nice to see you. Doctor, what is the primary purpose of your services here? And what are you, tell us briefly about, you know, we're talking about erectile dysfunction. So give us a little bit of overview of some of the things that,
obviously erectile dysfunction is a somewhat difficult topic for many people to breach. In fact, most of the time when we're with a patient, they come in for a visit, then they don't actually bring that up until the very end of the visit, right? So I'm here for the sniffles or the snuffles, and then, oh, by the way, doctor, I've been having this problem. And then, you know, once you have opened the door to that issue, then I think it's a lot easier to discuss it and talk about sort of what's happening. Why are you having dysfunction? Are you able to achieve an erection at all? Are you unable to achieve an erection? And then talk about the medical conditions that can affect, you know, erectile dysfunction: diabetes, high blood pressure, cholesterol, anxiety, stress, you know, personal issues. All of these things play into it. And then once you've sort of defined what's happening in terms of the ability to achieve an erection of some kind or no erection at all, looked at the medical conditions that can affect it, then you can sort of develop a treatment plan that says, well, let's look at the things that affect it, what testing should we do, and then here are some of the therapies we can offer to restore function for those who have really no function.
And Rizwana, what are the age ranges that you primarily see this in, or is it really spread out?
The age can be spread out, so it can be from above from 20 years and on. But however, the most common age is from about 50 years to 75 years. That's when also you see other medical issues like high blood pressure, diabetes. So at the same time that those conditions are coming on, that's when erectile dysfunction is also present. So it can be wide, but still from 50 to 75 is a wide age group.
Now, do you find that you know, you mentioned, Doctor, the different causes of this, or likely causes, stress, definitely. Do you find that the age ranges, maybe the causes of this may change? Maybe if you're 50 years old and you know, you're still working, you might have financial problems and things like that. But as you get older, you're retired, it might be a primarily different cause. Do you find that to be the case?
Well, certainly, when you look at erectile dysfunction in terms of what we would term an organic cause, which means there's a reason why you cannot achieve an erection, and that really occurs in older patients, ones who let's say are 65, 70, 75, 80 years old, where they primarily suffer the effects of cardiovascular disease. And so cardiovascular disease is probably the main thing that affects erectile function. You know, when you think about an erection, it's actually a fairly simple process.
Right.
But blood's going to flow into the penis, and then once the penis is erect, it can't flow out until after the person's achieved ejaculation,
right.
And then it flows out. Now, if you can't get blood into the penis because an artery is narrowed or blocked, then you cannot get, an erection. Or if you have diabetes and you have a neuropathy, so you have the nerves that control that blood flow are affected, you can't get the blood in to create an erection. So for those individuals, which I would term sort of a pure erectile dysfunction, no ability to get an erection in any way whatsoever, for those people to have an organic cause, and certainly some of the treatments we offer basically skirt around that and allow us, through the medication, to increase the blood flow and achieve an erection so they actually can engage in intercourse.
Yeah, and you made that very, very clear, yourself being a cardiologist and relating the two, that, for a layman like me, that makes a lot of sense. So that, the way you said that, that's as one of the causes, it just, you can see the correlation there. Is it curable?
Curable? Well, again, it depends on the underlying cause of the person's erectile dysfunction. If it is due to a medical condition, then we can certainly help treat the medical condition, which will help improve erectile dysfunction. However, one of the reasons we're here today is because it is very treatable. So regardless of the cause, the treatment is there, and some of the patients have heard about it on TV, most likely, or through their friends, and they know that there is a treatment out there, and they want to get more information through us and try to give them the treatment options.
Yeah, so, with the Super Bowl weekend, I bet we'll be seeing a lot of that on Sunday, right? You talk about there's different types of medicines, and of course we all hear of the over-the-counter ones. In fact, we're blanketed with ads for Viagra, and really now Cialis is the one that you hear about a lot. Are these similar to, is this what you use, or are there some other techniques or medicines that you might be using that that are different from these, not really over-the-counter ones, but the ones that people commonly know?
Right. Well, in the past I have used the medications that you have mentioned, but right now we have a new treatment, and that's what we want to offer to our patients. It's an injectable medication that works much faster. So within 5 minutes, they can achieve an erection.
Okay.
And some of the patients may have already tried some of the medications that you've mentioned already, so they want another option. And so that is the main purpose of this medication, is that a lot of the patients may have tried other treatments, or they may have side effects from the other treatments, or they may not even be able to go on some of the treatments due to the side effects and the medical conditions they have. Okay.
Now, you mentioned injection. I'm going to say right now, that sounds like it could be might hurt. I'm not sure that's where you put the injection, but you talk about that you can achieve an erection in 5 minutes. Is this something that people would do to themselves? In other words, they keep a kit at home?
Yeah, the therapy is self-administered. Obviously, we would see you in the clinic. We would determine the cause, whether or not this would be a viable therapy for you. And then we do train the individuals. We go through the little course to help them understand how to use that. And I think it's, one thing I would say that's really important is, if you see a patient, you're going to talk to them about what's happening, and you're going to go through sort of staged therapy, and drugs like Viagra and Cialis and Levitra, these are all very effective medications for the individuals they're made to be effective in. And those individuals are ones who can begin to achieve some form of an erection. And what I always tell patients is, these drugs take whatever erection you can achieve and make it better.
Okay. All right.
For the individual who's unable to achieve an erection at all, and there are many people out there like that, the therapy we're offering, or we offer, allows them to administer it to themselves, have an erection when they would like to engage in intercourse, and not have to wait to see if a pill is going to work for them.
Right.
You know, and that's one of the great setbacks when it comes to drugs like Viagra and Cialis and Levitra. You know, you have to take it at least an hour or more before you anticipate, you know, engaging in intercourse. Now, certainly, at this moment, maybe you both were feeling like it was going to happen, and then you take the pill, and then, you know, life,
right.
okay, you know,
life changes.
I've got a headache, you know, or whatever it is, and then suddenly, you know, the desire, the need to do it passes. Whereas when you can say, well, you know what, wow, we're really feeling like this is our moment, then you can administer the drug, have your erection, enjoy intercourse with your wife or your spouse, and not have that delay or, gosh, is this going to work for me?
Yeah,
you know?
and it's good. And I see you have about a 95% success rate.
That's right.
Very
Very
good.
effective.
All right. Well, again, you know, it's a delicate subject, but it affects a lot of men, and there's a place that they can go now and really get some answers besides the commercials that they see. You know, the guys walking down the path, and all of a sudden, you know, they look at each other, and you know, the dog runs behind, and all that kind of stuff. But I urge you to call Laguna Medical Care if you want some confidential information about this, and you can call them at 949-203-3387, 203-3387, 203-3387. On Cabot Road, what's the cross street there?
It is Paseo de Valencia.
Okay, so right about where that ends.
Close.
Okay,
Yes.
got it. Well, thank you so much. It was good to see you again.
Same
Nice to
here.
meet you.
My pleasure, really.
All right.
Thank you very much.
Good luck to you. And folks, give them a call. If you need the help, this is the place to go, all right? We'll be back in just a moment.